The pain experience. As you're looking at this slide, you may notice a physical reaction to looking at something that says the pain experience. And I want to just give you a minute to notice that and to let you know for the next 4 slides, we'll be specifically talking about discomfort and how it can be experienced before we go into ways to increase your comfort. So just take a minute to recognize this, and you can also take a look at the rocks that are behind the words and notice how smooth they are and how wet they are. And if you want to, let this be part of your experience too, that there's some discomfort and there's also something else, and you know that you're doing something to help yourself feel more comfortable. So what do I mean by the pain experience? It's what it's like to live with pain, and you may already know this, but to just let you know that sleep disturbances is a pretty common problem, and it can be pretty significant with people that are living with discomfort. It's not unusual for people to feel more comfortable during the day, and then as you get into bed and you're trying to move yourself around a little bit to make yourself more comfortable, you realize how uncomfortable you are. Part of it is because you're not distracted, and part of it may be that your body is naturally tired from being through a day, and that may increase your discomfort. But it's just important to know that if you are consistently having difficulty with sleep because of discomfort, to get some help with that. We've already talked about depression, and depression is quite common with pain. And pain-related fear and avoidance can increase anxiety. So what does that mean? And we'll talk much more about this next week. But it means that there may be things that you're avoiding because of discomfort. And the more that you avoid it, the more it may increase your anxiety. So this way of trying to take care of yourself sometimes may increase your stress. We'll be looking at ways to take care of yourself that don't increase your stress. And lastly, the loss of sleep and the depression and the stress, of course, can increase the discomfort. So once again, we talk about something that's pretty circular. So let's see where we can intervene. Living with discomfort really affects people psychologically. And it's important to remember that discomfort and your response to it can completely change your life because it can take over and make your life smaller. It can change your identity. You can forget who you are and become associated with your discomfort. And the discomfort can really invite you into a world of depression and fear if you let it. But I want to remind you, which is why I have it in big letters here, there are options. But just know that, once again, this is a natural response to living with discomfort, and there are other options. So one of the options might be to seek some professional help, whether this is from a physical therapist or a doctor, a pain management specialist. And before you go, it's important to know certain things so you can get help. So people that are there to help you can know exactly what's going on. So it's important for you to understand how you would describe your discomfort. These are questions that would be asked. What does it feel like? Is it burning? Is it tingling? Does it feel hot or cold? So when you have a chance to check in, see how you would describe your discomfort. Where is it located? Sometimes it may feel like it's all over your body, but there may be one place that's more painful and the discomfort radiates out from there. And that's important. How severe is it? When you're noticing your comfort, you probably have already been aware of your discomfort when you're doing the log. 0 is complete comfort if you're looking at discomfort, and 10 would be the maximum amount of discomfort you can imagine. That's often how people in the medical field will rate it, a 0 to 10, with 0 being no comfort, 0 being no discomfort, and 10 being pretty much no comfort. When are you most comfortable, least comfortable? Well, this is what the awareness log is there to help you with. So you can really understand that and report this. And what helps relieve the pain? What makes it worse? Again, this is one of the reasons why I've encouraged you to do the awareness log. And a really important thing is to know how it's interfered with your sleep or your daily activities, so that when you go in to talk to someone, you can let them know about this. So now that you've gathered some of this information, how do you talk to your doctor about pain or to any medical professional? What you want to be able to do is communicate in a very short period of time exactly what you want this person to know, because sometimes the appointments, as you know, are quite quick. So you want to come in with as much information as you possibly can and be as descriptive as you possibly can, so that you can communicate and this person can really understand what you're experiencing. So try to be factual, not minimize or use overly dramatic language. And what I mean by overly dramatic language is it hurts all the time. That may be your experience, but to your doctor, that doesn't help. What does help is, I notice that at this time of day, I'm experiencing this in this part of my body, and it's at this level between 0 and 10. And go through it. And some days I notice that it's better or not so good. And this is how I'm responding to any medication you may be using or any other intervention you may be doing. It's helpful to have it all written down so that you don't have to remember it. You can even have it written down or typed up and on your computer run it out and hand it to your doctor. You can bring your log with you if you want, and that might help you. In your handouts, there's a body chart. Bring that with you. You can run it out and mark it up so that you can mark on this body chart where you're experiencing certain things and the different types of experiences you're having. And it will help both of you to be able to look at the body part and point to the body part rather than having you touch your body, which may be not feeling very comfortable at the time. And you can explain, look, it starts here, but it seems to radiate over to here by using the body chart. And it's important to be honest about your use of pain relievers with your doctor for a couple of reasons. One is that what you're using may not be effective for you. And if you're using more than is prescribed, maybe something else might be better. But secondly, all medications, including over-the-counter pain relievers, have side effects. So it's important to let your doctor know exactly what you're doing, because if you're not using the prescribed dosage, you're using higher than the prescribed dosage, you may be experiencing some side effects the doctor can let you know about and work with you on it.